Hi everyone and welcome to Future Horizons. I'm your host Inaya Zahid. Today I'm joined by the wonderful Dr. Sadaf Zaidi, a radiologist whose kindness, insight and passion for helping others truly stands out. She's here to share her journey through med school, her career and life, what life as a doctor really is. Let's dive in. Here's my conversation with Dr. Sadaf Zaidi. Hi Dr. Sadaf, how are you?
I'm good, thank you.
Thank you so much for coming on to our podcast.
You're very welcome.
Are you ready to get started?
Yes.
What inspired you to go into medicine and how did you know radiology was the right fit for you?
So, medicine was kind of a by chance choice. I already had two elder sisters who were doctors, and where I grew up in Pakistan, it's mostly expected that you either become a doctor or an engineer, So the same fate was probably written for me, but I didn't really want to go into medicine initially. My passion was to do PhD in genetics. But my father, he was in the army, so he got transferred to a place where there was not many options to do genetics particularly. So I eventually said, okay, I might as well become a doctor and then go into genetics after that. So that's how I actually ended up in medicine. It's not that I didn't like it. I loved it when I eventually went into med school, but it wasn't like a passion from childhood or anything like that. And then radiology, so when I was doing my internship at Al Khan University Hospital in Karachi, I did like 6 months rotations in medicine and 6 months in surgery. So during that one year, I there was a lot of interaction with radiology, and especially during on call. I used to go to the radiology department to discuss imaging and reports, for my patients. And I used to see that, the radiologist is just sitting comfortably in their reading room, and it seemed like a really, chill job. So I decided that I might as well just, pursue this after my internship. So that's how I went into radiology.
It's a very moving story. Thank you.
Sure.
Can you share a little bit about yourself, where you went to med school, your journey?
Sure. So I come from a family of, I have three more siblings. We're four sisters. My dad was in the army. My mom was a housewife. I'm the youngest of the four. And I did most of my early education was in England when my dad was doing PhD in Cranfield. And then we moved to Pakistan. He was serving in the army. So we moved all over Pakistan. So had education mostly in all the Air Force based schools. And then I eventually ended up in med school, as I told you, which was called Dow Medical College in Karachi. It's a very prestigious institute. I had around 400 students in my class. So it's like a huge school with, like, every year you have around 450 students in each class. Then how I ended up in radiology, I already discussed. But when I came into radiology, it was pretty challenging because in med school I didn't get much exposure to radiology, so it was like starting from scratch. We didn't look at a lot of X-rays in med school in Pakistan, so it was something very different. So I had to learn physics, which I hadn't done for a long time in med school. So if anyone wants to pursue a career in radiology, they need to keep that in mind, that it's a very different field from other medical fields because there's not a lot of clinical exposure, patient exposure. It's more just understanding imaging and looking at the human body. It's a lot of anatomy that's involved. So yeah, so that's about how I thought the field was and how
Those
I
are some
met.
great insights. Thank you.
You're welcome.
For those who may not know, can you share what exactly a radiologist does, what conditions they diagnose?
Sure. So a radiologist is, first thing that like to make clear, that a radiologist is a physician, right? It's not just someone who takes x-rays or anything like that. So radiologist is a qualified physician, MD, who has a license to practice medicine. And the main thing that they do is that they read all kinds of imaging. So imaging includes x-rays, ultrasounds, CTs, MRIs. And they also, there's a certain kind of radiologists that are called the interventional radiologists that also do procedures like biopsies, angiograms, stuff like that. But what I am is a diagnostic radiologist. My main job is to look at imaging and diagnose disease. So there's a vast variety of disease that is diagnosed through imaging, right? So it's not just a particular disease. So you can either be a general radiologist. A general radiologist is basically looks at every kind of imaging. But there are also subspecialized radiologists who have done additional training in certain body parts, and they subspecialize in those diseases concerning with those particular body parts. So my passion is neuroradiology. I've done a fellowship in that. And so I read mostly imaging related to the brain and the spine.
It's very cool. Thank you. What was medical school like for you, and what advice would you give to students who would like to attend medical school one day?
Sure. So medical school for me, I trained in Pakistan. So medical school in Pakistan is very different from medical school here in the USA. At least at that time when I did it, which was back in, I graduated in 2002. So it's been a long, long time. But for me, medical school was one of the, best 5 years of my life. I never regretted going to medical school. It was very fulfilling, reading about the human body, how it functions, the anatomy, and then looking at helping patients, fulfilling emotion that you feel when you treat a patient. I learned all that in medical school, and apart from that, I had made a lot of good friends during those 5 years that I know that are my friends till now, because you're at that age where you are kind of mature, you're an adult, right? 18 and above. So you start making relationships with your friends that are long lasting. So I really enjoyed my medical school. For nowadays, for kids that want to go into medical school, especially here in the USA, I don't want to scare anyone or anything, but it's pretty competitive. You have to be exceptional to get into med school, and you have to work really, really hard. You have to study hard. You have to work on your extracurriculars, and just be passionate about it. Because I know that medical school over here is very hard. Even when you get into it, it's hard. But if you're passionate about it, then things become easy. So passion is very important if you want to go into medical school.
Yeah, passion is key.
Yeah, definitely.
What was the most memorable case or diagnosis you made, and why did it stand out to you?
Yeah, so this was actually here when I was doing my fellowship in neuroradiology. So I used to be on call every fourth night. And the call also included neurointervention, which means that if a patient comes in for an emergent neurological related procedure, then I also had to streamline that with the attending and go into the hospital to get that done. Those interventions usually took place at Harborview Medical Center, which is a level 1 trauma and stroke center. It was just a regular call, and I got paged that there was a stroke patient that had just come in, and they needed immediate intervention. So usually what happens is that that patient had an MCA stroke, which means the middle cerebral artery, which is the main artery that supplies the brain. There's like a clot in that artery. And if it gets lodged there, then the supply to that side of the brain is stopped, the blood supply. So what the neurointerventional radiologist has to do is that they have to put a catheter through the groin into the artery and take it up all the way up to the brain and then retrieve that clot and take it out. So the main thing about that whole situation is that it's very it has to be done in a very timely manner, because the longer the supply to the blood supply to the brain is cut off, the more chances that your brain is going to get a stroke, right? So that was I was pretty anxious. I was a new fellow. I had to quickly rush to the hospital, take consent from the patient's family. Obviously the patient had a stroke, so couldn't give consent, and then streamline everything. And I wasn't the main one doing the procedure, but I was assisting the procedure with the neurointerventionist who was on call. And we went in, and he retrieved the clot. And right after the clot was retrieved and the blood supply to the brain came back, the patient immediately, his symptoms reversed. He came in with flaccid paralysis on one side, and the next day he was discharged, walking out of the hospital. So that was so fulfilling, seeing a patient totally paralyzed on one side, and then you do this procedure, you retrieve, that clot, and the blood supply to the brain is, revived, and the patient goes discharged the next day. Well, that happened, and a few days passed, and then at my home I got this in the mail. I got a box of chocolates and a card, and I opened it up, and it was from the patient, and he had written that, "Thank you so much, Dr. Zaidi, for saving my life." So that was so touching. And that was, although it was kind of later in my career, I had already become a radiologist and I was subspecializing, but I just realized the importance of radiology. Because not only just retrieving the clot, but radiologists, the neuroradiologist who read the CT angiogram, the CT that was done that saw the clot, also played a very important role. And until now I read stroke patients when I work, and it's really fulfilling when I follow up with the neurologist and the neurointerventionist that the patient did really well, and they were discharged without any symptoms. And so that was something that really touched my heart.
It's a really heartwarming story.
Yeah.
What's a typical day like for you, and what part of your job do you enjoy the most?
When I work like routine day shifts, it's just as I said, I read neuroradiology, so I mostly read MRIs of the brain, MRIs of the spine, usually tumor follow-ups, back pain, patients with degenerative disc disease and stuff. What I enjoy most are my when I'm doing like after hour shifts, because in those shifts I'm mostly reading ER and trauma patients, and like I said, stroke patients. So that's pretty exciting. And there's a lot of interaction between, when I'm reading those studies, between me and like the ER physicians and the neurologists and the neurosurgeons, when I have to call them to tell them about emergent findings. And so I really enjoy doing that the most, as far as, everyday work is concerned.
It's definitely a team effort.
Yeah, definitely.
How do you balance work, family, and personal time with such a demanding career?
Mm-hmm. So I think radiology is a field where, when you're working, and when you're not working, you don't really take any, work home. That's one thing I do like about radiology. So when I'm working, I'm working. When I'm not working, I'm with my family, my friends, or whatever way I want to, spend my time. And there's also there's lots of options where you can have flexibility in your job, even though it is a demanding career. Like I said, I like to work after hour shifts, so I like working nights usually. So my schedule is where I work a week of nights and then I have 2 weeks off. So those 2 weeks off are basically to kind of recuperate from the nights, and then I also get time to spend with my family. So, even though people think that being a physician, work life balance is not easy, but there are flexible schedules available when you eventually do end up getting a job after your training and everything. And it's manageable. You can have work life balance.
I'm glad to hear that.
Good.
How do you handle stress or fatigue when reading scans for hours?
Yeah, so that's a good question. I think that you kind of, in the beginning, it's always difficult, especially when, like I said, you're working after hours and ER shifts. There's like a constant turnover of imaging. So we have like a huge work list on which we read from. I work for private practice, so we read for around 35-40 facilities. And imaging from all these facilities keeps dropping in that common work list, and you just have to pick imaging as it comes on first come first basis. In the beginning, when I started working as a attending physician, it was not easy. It was pretty stressful, and especially when you're working after training and there's not another more experienced radiologist who's going to be looking at your report and signing it off. It's your name that's going under the report, right? So it's a lot of responsibility. You have to be very careful. But I think as time goes by, like with any other job, you gain experience. You kind of have to form a search pattern so that you make sure you don't miss anything. And it's extremely important to correlate with the patient's clinical history to be sure you answer the question that the clinicians have asked. Like if somebody comes in with abdominal pain, if the indication just says abdominal pain, I would dig more into it, like where in the abdomen is the pain? Are there any other symptoms, so that I can focus on that specific body part and specific diseases that can cause those symptoms, right? And be more helpful to the clinician and come up with a proper diagnosis for the patient. So yeah, so it in the beginning, like everything, it's difficult, but as you work, with time, it's been 10 years now since I've been working as attending, and with experience it becomes easier. And again, I would say I like the fact that I don't take my work home. Once I'm done with the scan, I'm done with the scan. I do usually, in some cases, follow up on certain scans where there's like a unique diagnosis or something that's rare that I've given as a differential diagnosis. I usually follow up with the clinician or with the surgical report to see whether I was correct or not. But other than that, I think radiology is a good field in that sense that it's when you are working, it's stressful. With experience, your stress decreases because you become more confident in diagnosing the diseases. But it's good that you don't take patient symptoms and stuff back with you home. You just leave it where you're done reading the imaging.
It makes the work-life balance a lot easier.
It does, definitely. Yeah.
How has technology or AI changed your daily work, or how will it change your daily work in the future? What are your predictions?
Yeah, so AI, a lot of people think that radiology is one of those specialties which is going to take over AI, and there's not going to be any more radiologists. I heard that around maybe 5-6 years ago, that in 5-6 years radiology will be taken over by AI. Well, that didn't happen, and I'm one of those people who doesn't believe that that's going to happen, at least in the next 20 years. I do believe that AI is going to help a lot in making the diagnosis and helping radiologists with workflow. But I don't think that AI can take over a radiologist job. We're using AI already, especially in workflow. For example, we're using a software where AI recognizes the way I read imaging, and then when it's time to come up with the impression, it generates the impression by itself based on how it learned the words that I used in my report. And it's not always completely 100% correct. I always have to read through it and make some corrections, but it does shorten the, kind of save time when compared to me dictating the impression, because the impression and report has to be a summary of what you just read, right? So when I used to dictate it, it used to take more time. Now I just click my mouse to go to the impression field, and it starts generating the impression. It actually gives me more time to go through the images and look through the images. So that's one example where we're using AI. We are also using AI in diagnosis, but a lot of the times it makes mistakes. So it needs a human eye and human judgment, especially to clarify whether whatever it's detected is right or wrong.
So it's more of a helping hand.
Definitely a helping hand.
Thank you so much, Dr. Zedi, for joining us. I appreciate your time, and I hope our listeners will gain some insight from this.
You're very welcome.
Thank
It was
you.
a
Have a
pleasure.
good day. It was
Thank
a pleasure
you.
having you on our podcast.
Thank you. Bye-bye.